The ACCC David King Community Clinical Scientist Award was established in 2006 to recognize clinical researchers who demonstrate leadership in development, participation, and evaluation of clinical studies, and who are active in the development of new screening, risk assessment, treatment, or supportive care programs for cancer patients. Dr. David K. King was an ACCC past president who passed away after a brief battle with cancer. His career was devoted to advocating for access to quality care and championing the value of clinical research in the community setting. The 2021 recipient is Dr. B. Lee Green. Dr. Green is the Vice President of Diversity, Public Relations, and Strategic Communications for Moffitt Cancer Center. He is also a professor in the Health Outcomes and Behavior program at Moffitt. As Vice President for Diversity, Dr. Green is responsible for ensuring that Moffitt is responsive and actively creating a culture of diversity and inclusion as it strives to contribute to the prevention and cure of cancer. This includes addressing issues such as awareness and education of cancer prevention and control, community outreach activities, cultural competency, equity and inclusion issues, development of strong partnerships with community organizations, and support for other key initiatives. In 2016, Moffitt was ranked Diversity Inc.'s top 10 hospitals and healthcare organizations for fostering diversity and inclusion based on a rigorous data-driven survey gauging detailed demographics based on race, ethnicity, and gender, and some of the largest US employers. Dr. Green's research interests focus on cancer health disparities, particularly minority participation in research studies. As a key member of various research teams throughout his career, Dr. Green has secured over $26 million in grants. His work related to minority participation in research studies led to Dr. Green's membership in the Tuskegee Syphilis Study Legacy Committee and an invitation to the White House for the formal government apology. In a recent interview, Dr. Green commented that COVID-19 has shined a light on disparities and that all businesses and companies should be taking a hard look at diversity and following the data so they can directly represent the communities that they serve. It is an honor to present Dr. Green with this award in recognition of his achievements in this critically important area.
Thanks so much, Krista, for that introduction. It is such an honor and a privilege to accept the David King Community Clinical Scientist Award. Although this is an individual award, I must accept on behalf of all the people who have worked by my side for so many years. You know, the success that I've had over my career is only possible through the many partnerships and collaborations with some incredible individuals and many key organizations. And I'm so honored to be named alongside of some of the past winners of this award, many who have made some outstanding contributions to the field. So my thanks to the Association of Community Cancer Centers for recognizing me in this incredible way. I am truly honored and truly humbled by this recognition. So thank you so much. So again, I'm Lee Green, and as Krista said, I'm the Vice President for Diversity, Public Relations, and Strategic Communications at the Moffitt Cancer Center. And I'm so delighted to have this opportunity to share some of the work that I've been involved in over the past few years. And let me start by saying that I have no financial conflicts of interest to disclose today. And the learning objectives, I hope that by the end of the session that you will be able to define various types of disparities in cancer care and also be able to provide examples of health equity in action. Again, so appreciative of this opportunity to share with you today some of the work that is happening at the Moffitt Cancer Center in Tampa, Florida. And I'm always excited to share my knowledge around health disparities, around diversity, inclusion, and equity. And so today I'd like to talk briefly on the topic of a patient-focused comprehensive plan for diversity, equity, and inclusion at a comprehensive cancer center. And what I focused on in my work is really trying to make sure that every single patient who is diagnosed with cancer has the opportunity to come to a comprehensive cancer center that will give them the best possible outcome for their diagnosis. And this is regardless of how much money they have, what side of town they live on, who they love, what God they serve, the color of their skin, or how much influence they might have. Our cancer center is considered the cancer center for the state of Florida, which means everyone should have the right to come to such an incredible place to help them fight their cancer. But you know, the other side of the coin is that when they show up at our doors, we want to make sure that we are creating an environment that makes them feel like they belong here, that they see people that look like them, that they feel like they are important regardless of their situation or their circumstances, that if they speak a different language, they know that we care about that and that we will provide them with the right resources so that they can communicate effectively with their care team. And we want them to show up at a place where their religious requirements are considered and deemed an important part of their care. So all we do is patient focused, and that is the reason why we do what we do. You know, my background is in public health. I have a public health doctorate from the University of Alabama and the University of Alabama, Birmingham. It's a joint degree between the two institutions. And my focus has always been on health disparities. But back in the mid 80s and early 90s, it was called minority health, if you remember that. And I remember having a conversation with my major professor about what I wanted to focus on. And I mentioned this issue of minority health. And so how I landed on minority health was from a personal experience with my grandmother, who suffered severely from diabetes, so much so that she had to have both of her legs amputated. She lived in our household, and so that meant that I became a part of her care team. And as a young teen, it just did not register to me why she would be having these major health issues. And I've always wondered what she could have done differently so that she would not have to face this incredible battle. And I asked her, you know, why she felt like she was suffering from diabetes. And her answer as a young kid sort of shocked me. And she said it was because it is God's will. It is God's will for me to suffer from this disease. You know, I remember because there was no recognition of her eating habits, no recognition of her being overweight, no recognition of her not wanting to go to the doctor or taking her meds appropriately, not exercising, all those types of things. No recognition of that. It was just that it was God's will. And I can tell you that that stuck with me and had an impact, so much so that I wanted to work in a field where I thought I could make a difference. What I did not know at the time was that my grandmother was a part of the data points that we would now consider a disparity. And as we know, health disparities is one of the most pressing health issues that we face today. And COVID-19, which we're experiencing now, has really shined a light on the disparities issues that we continue to face in this country. And as a PhD student, I always knew that I wanted to do some work around this issue of minority health and disparities. Again, being influenced by my grandmother, who suffered severely from diabetes. And so during my career that started in the mid 80s, 1990s, I've been fortunate to lead many efforts addressing disparities and equity, diversity and inclusion. I've also done work examining the issue of low participation of minorities in clinical trials and research studies. More specifically, I worked with teams that investigated the impact of the US Public Health Service syphilis study at Tuskegee. You know, it was a question of how much has that study impacted the decisions of minority populations, particularly Blacks, to participate in clinical trials. And as a result of my work in that area, I was so fortunate to be invited to the White House by President Clinton to witness the apology to the men and their families who were a part of that syphilis study. And so during my career, I've been able to help raise money for disparities research. I've worked with political and business leaders, celebrities such as Vivica Fox, you see listed or pictured on the screen, many notable sports personalities, many community members and community leaders, all who see this issue as something that is important for us to address. I've had the opportunity to speak all across the country to share the work in disparities, and more importantly, to encourage all of us to do more in this space. I've also been fortunate to be funded to do this work as well, and be able to share my findings in scientific journals. And I've also found some time, as you can see in the photo, to have some downtime to enjoy a sport that I really love, and that's the game of golf. And I share all of that just to say that I've had an incredible journey with my career, trying to address disparities, trying to address inequities that exist in our country. And it has not been, I cannot tell you how rewarding it has been throughout this journey. I found myself at the Moffitt Cancer Center 15 years ago when I joined the organization, had some great jobs and worked at some incredible institutions. But the Moffitt Cancer Center is truly a place where there is care and there's concern for our most vulnerable patients and our most vulnerable populations. When you are at a place that truly understands why this work is important, it certainly makes the work a whole lot easier. So everything is patient-centered. So I want to talk briefly about the Cancer Center, just briefly, just give you a little bit of a flavor of who we are as an organization. Moffitt was created, it was created as a result of a true champion for cancer patients. Then Florida Speaker of the House, Mr. H. Lee Moffitt, he lost 3 friends to cancer who had nowhere to turn in Florida for cutting edge care and cutting edge research. Mr. Moffitt, who is pictured here, is at the groundbreaking of the Cancer Center back in the mid-'80s. Moffitt opened with an innovative multidisciplinary approach to patient care. Its equal commitment to breakthrough cancer research helped Moffitt to earn an NCI designation, National Cancer Institute designation, and Comprehensive Cancer Center status, faster than any other program at that particular time. Moffitt is now recognized by U.S. News and World Report as one of the top cancer centers in Florida and in the country. We have a singular mission, and that mission is to contribute to the prevention and cure of cancer. That mission may sound very plain, but it's a very powerful mission. Absolutely incredible work. It's incredible to work at an organization where everyone is working towards the same mission. Our goal for our patients is to help them find the right diagnosis, to find the right treatment that is wrapped around the support that they need, all in one place, all in one location. We're extremely busy as a cancer center with over 400,000 outpatient visits almost each year, and approximately 70,000+ total patients that are seen year to year. And we also continue to see our new patient volume increase year over year, which tells us that cancer is still very active and still very alive. And we need to continue to fight as hard as we can for our patients and for their family members so that we can defeat this disease. We are extremely proud of the research that we do at Moffitt. We have researchers who are working on and developing cutting edge discoveries that are rapidly translated to our patients, which is the goal. You know, the overall goal is to improve the diagnostics, to improve prevention, and improve all of the therapeutic efforts for better outcomes for all of our patients. We have a very robust research portfolio, over 120 million in research funding last year, over 250 million in state and federal and commercial grants since fiscal year 2013. So again, a very active and very robust research enterprise. At Moffitt, we are very proud of our collaborative spirit. We know and we understand very clearly that we will make progress in this fight with our patients much quicker and much more efficiently with partnerships and collaboration. This shows the ecosystem of our current relationships that represents industry, managed care companies, health systems, and also investors. Moffitt is truly a place that believes strongly in the power of collaboration, both internal collaborations and external collaborations. And the spirit of collaboration just flows throughout the entire organization. And so that's just a little bit about the Moffitt Cancer Center. I would certainly encourage you to go and visit our website. There's a whole lot more information about our center there. And so I want to switch gears and talk a little bit about cancer health disparities. We're very proud of the work that we do in this space. Health disparities is a core pillar for us at Moffitt. And let me start by saying that we are living in a time of extraordinary promise in cancer research and treatment. And that's been highlighted in many progress reports as it relates to cancer. In 2020, the overall cancer death rates are steadily declining, and the number of survivors living with cancer has reached an all-time high. And this is fabulous news, great news. But the unparalleled progress against cancer is being driven by science that is transforming how we fight this disease, new advances in public health efforts, and other breakthroughs across the entire continuum of cancer research and cancer care. However, progress against cancer has not benefited everyone equally. And there are certain segments of our US population that shoulder a disproportionate burden of this disease. Racial and ethnic minorities and other underserved populations are among the groups in the US that have long experienced cancer health disparities. A glaring example of these disparities is that African Americans have the highest overall cancer death rate of any other racial or ethnic group in the United States. The stark inequalities in cancer burden have drawn renewed attention and concern in the face of this ongoing COVID-19 pandemic, as well as the recently witnessed inhumanities against people of color. The significant social and health inequities experienced by racial and ethnic minorities are a result of decades of structural and systemic racism. And there's a whole body of literature that talks about this issue. So therefore, as a research and a cancer care institution, Moffitt is focused on the prevention and cure of all cancers, and whose core values include equality, diversity, and inclusion. And we are committed to realizing the vision of social justice and equality for all racial and ethnic minorities, both nationally and globally. So much of the work that we do is centered on addressing cancer health disparities. So, the question is, what are health disparities? And I know many of you are familiar with this area of study, but according to Healthy People 2020, and it says that health disparities are defined as a difference in health that can be linked to social, economic, and or environmental advantages. And then if you look at the National Cancer Institute definition, it says that disparities are adverse differences in cancer incidence, prevalence, death, survivorship, and overall cancer burden that exist among certain population groups in the United States. Health disparities, as many of us know, can be very complicated to untangle because there's so many risk factors that can be associated with disparities, which includes genetic factors. There are healthcare access issues, socioeconomic factors. There are even chemical and physical exposures. And then, of course, things like diet, physical activity, just to name a few. We are well aware that health disparities may impact individuals based on their age, their education level, their race, ethnicity, their culture, socioeconomic status, sexual orientation, disability, and also where they live. Their geographic location can also cause disparities. And so the major question on the table now is, how do we reduce cancer health disparities? And we have focused so much of our efforts up to this point on health disparities, in that we have identified the problems, we have identified the differences, and now we have to transition to what we term health equity. Health equity is the action part of the equation, which is a commitment from all of us to reduce and to ultimately eliminate these disparities. Health equity really means that we will strive for and we will pursue the highest possible health for all people, and that we will give special attention to the needs of those who are at greatest risk of poor health based on social conditions. We can see from the graphic that equality is not going to get us where we want to be in terms of reducing disparities. We have to focus on equity, which means making the needed adjustments in those populations that are most disadvantaged. And our hope is that one day in our society, that fence that you see will be gone. And those are all of the barriers to quality health care for all of us that will eventually be eliminated. That is the ultimate goal, is that we completely eliminate the barriers. And so at Moffitt, we are working hard each and every day to address equity issues for our patients and for their families. Everything that we do revolves around the patient. I've said that before. And our vision is to advance and to accelerate a culture of access, equity, and inclusion. We believe that through that vision, we will have patients from all communities who will experience the best cancer care possible, that there will be equal access, that there will be a focus on equity, and there will be a focus and on a culture of inclusion. So I want to talk just a little bit about some of the concepts that are core to what we do. So transforming cancer care equity practices, which means that we are constantly identifying any disparities that we see at our cancer center, and we try to address them head on. That we are aggressive in our promotion of inclusion across the cancer center so that everyone there feels that they belong, from patients to their families, to team members, our diverse vendors even, and obviously the community. And we must ensure that we have the needed resources in place to do this work. You know, we've all heard that popular quote, no money, no mission. We have to have the funding, we have to have the support in order to move the needle in this work. The other key pieces revolve around recruitment and retention of a diverse group of team members, diverse faculty, leaders, physicians, etc. We believe wholeheartedly that diversity makes us stronger as an organization. And the only way to bring about diversity is with an aggressive strategy for recruitment and retention. We must also make sure this work is enterprise-wide and not just the work of a diversity department in your organization. We know that the only way to make true change is if everyone in all parts of the organization are part of these efforts. And finally, ensuring that all patients, team members, and students see themselves and everyone else at the Moffitt Cancer Center. So do we look like the communities that we serve? When our patients show up at Moffitt, we believe that it is very important that they see people who look like them all across the cancer center. So do they see themselves represented when they are there? And I just want to share briefly about our approach, which is centered around 3 buckets, or what we call 3 lines of effort. The first bucket is around what we call the unity of our effort, which simply means that diversity, equity, and inclusion is the responsibility of every person at the Cancer Center, and is not just the role of the diversity department. The second bucket is around reflecting the community. We have to ask ourselves, do we as an organization reflect the individuals in the community that we serve? Do our patients, reflect the community? Do our team members reflect the community, our leaders, our board members even? If the answer is no, we have to put things in place that will address this issue, which means we must have a long-range plan or strategy in place that ensures that we are recruiting and we are retaining and advancing a diverse set of individuals all across the organization. And then finally, the third bucket is what we refer to as widening Moffitt's doors. In other words, how do we expand access to these populations that are most impacted by cancer health disparities? And a part of that effort is to have a very clear understanding of the unique cancer needs of all of these communities. And so the question is, how will we accomplish these three lines of effort? And it's through the leadership of our diversity and inclusion department. The department that I oversee is made up of three key areas: diversity, inclusion, cultural and linguistic competency, language services, and supplier diversity. I'm only going to talk about two of those areas today. But it is through those areas that we focus our work around enterprise equity. All that we do is really around this term that we call belonging, that patients feel like they belong, team members feel they belong, leaders feel like they belong. And the work of this department is undergirded by our collaborations and our partnerships all across the Cancer Center. That we will not be successful in this area of equity and inclusion and disparities if we don't have strong partnerships across the Cancer Center, and I should say also in the community. So community partners are critically important in this work. But there are so many areas across the Cancer Center that we are not responsible for as a department that has a direct impact on equity and inclusion. And so we have to ensure that we are partnering with all the right teams across the enterprise to make a difference in this area. And as I start to wrap this up, the one area that I do want to highlight briefly is around patient equity and the work in that space. We have incorporated cultural competency into our grand rounds, and we bring in national leaders to engage us in these important conversations. We formed an internal committee that includes a cross-section of leaders, and you can see the circles on the screen of some of the teams that are represented as a part of this committee. We have identified our four what we call focus areas that include data collection, which we all know is critically important. If you don't have the right data, we're not able to answer any of those questions around disparities, diversity, equity, and inclusion. But data collection that also includes LGBTQ data, making sure that we're not only collecting that data, but we're analyzing that data to identify any disparities within that population as well. Language and communication, so critical, particularly here in the state of Florida, where we have high numbers of non-English speaking patients. And so making sure that we have the infrastructure in place so that those individuals can speak to their care team in a way that is comfortable to them. We also look at patient experience, where we drill down into our patient survey data to the individual respondent by demographic area, because we want to see if there are any differences between populations in how they experience the Cancer Center and how they are treated at the Cancer Center. And then the final bucket, the fourth bucket, is around education. Having a robust education and training program that ensures that our care teams are prepared to provide service to individuals who come from different backgrounds and who come from different experiences. And I want to end by saying that all of our efforts are driven by what is best for our patients. That's the core of who we are, the core of the work that we do. And I'll end with one of my favorite quotes of all time that has really guided the way that I've gone about doing this work. But it's a quote by Peter Brodeur. The quote is, "Statistics are real people with the tears wiped away." Statistics are real people with the tears wiped away. And I love this quote because it should be our reminder that as we address disparities and equity issues, that we're dealing with real people and not just statistics. It is a reminder that every single data point is a person. It's a father, a mother, it's a daughter, a son, a grandfather or grandmother, a friend, or it could be a neighbor. And they're not just another statistic or data point. They're real people. And so the more work that we do in the community with real people, the more this quote sets into our mind. And so I thank you so much for listening. And once again, my thanks to the Association of Community Cancer Centers for this time and for the recognition of our work. Thank you so much. Really appreciate it. Thank you for listening. And once again, thank you so much.